Apples exemplify the principle that gout management extends beyond direct uric acid reduction to encompass broader metabolic health. The fiber content in apples, particularly the soluble fiber pectin concentrated in the flesh and skin, provides benefits that indirectly but meaningfully impact hyperuricemia and gout risk. Pectin functions as a prebiotic, feeding beneficial gut bacteria that produce short-chain fatty acids like butyrate. These metabolites have systemic anti-inflammatory effects and support intestinal barrier integrity. Since increased intestinal permeability has been linked to systemic inflammation and metabolic dysfunction, maintaining gut health through prebiotic fiber consumption supports overall inflammation management. The metabolic effects of soluble fiber include improved insulin sensitivity and blood glucose regulation. Pectin slows gastric emptying and carbohydrate absorption, resulting in more gradual and lower blood sugar peaks after meals. This matters for gout because insulin resistance and hyperinsulinemia are independent risk factors for hyperuricemia. Insulin appears to reduce renal uric acid excretion, so maintaining insulin sensitivity helps keep uric acid levels in check. Apple polyphenol, particularly quercetin and catechins, have antioxidant and anti-inflammatory properties documented in numerous studies. These compounds neutralize free radicals, reduce oxidative stress, and modulate inflammatory signaling pathways. While research specifically on apples and gout is limited, the general anti-inflammatory effects support the oxidative stress and inflammation associated with the condition. Quercetin, abundant in apple skins, has been studied for its ability to inhibit xanthine oxidase, the enzyme responsible for uric acid production. While dietary quercetin doses from apples are lower than those used in experimental studies, regular consumption contributes to overall antioxidant status and may provide mild xanthine oxidase inhibition. The low glycemic index of whole apples makes them suitable for individuals managing both gout and diabetes, a common comorbidity. Despite containing natural sugars, the fiber and polyphenol content of apples results in minimal blood sugar impact when consumed whole. This allows safe fruit intake for individuals who must carefully manage glucose levels. Apple varieties differ in polyphenol content, with generally darker red varieties containing higher concentrations than lighter varieties. However, all apple types provide beneficial fiber and contribute to overall fruit intake. Varieties should be chosen based on taste preferences to encourage consistent consumption. The importance of eating apple skins cannot be overstated. Much of the fiber and the majority of polyphenolic compounds concentrate in or near the skin. Peeling apples removes a significant portion of their nutritional value. Washing apples thoroughly addresses pesticide concerns while preserving the nutrient-dense peel. Apples provide satiety disproportionate to their caloric content. The fiber and water content create physical fullness, while the natural sweetness provides satisfaction. This makes apples valuable for weight management, particularly as snacks that can replace less healthy options. Since obesity is a major modifiable risk factor for gout, foods that support weight control have indirect gout management benefits. The phrase, "an apple a day keeps the doctor away," has scientific support in cardiovascular health research, with regular apple consumption associated with reduced cardiovascular disease risk. For gout patients who have elevated cardiovascular risk compared to the general population, foods that support heart health provide dual benefits. Apples contain minimal purines, making them safe during all stages of gout, including acute attacks. The combination of safety and therapeutic properties makes them ideal for unrestricted inclusion in gout management diets. Unlike some plant foods with moderate purine content that require portion consideration, apples can be consumed freely. The versatility of apples supports dietary adherence. They can be eaten raw as convenient snacks, baked with cinnamon for a healthy dessert, added to salads for crunch and sweetness, or cooked into unsweetened applesauce. This versatility helps prevent dietary monotony, which is a common reason for poor adherence to therapeutic diets. Organic apples may be preferable for individuals concerned about pesticide exposure, as conventional apples frequently appear on lists of produce with higher pesticide residues. However, the health benefits of eating conventional apples outweigh concerns about residues for most people. Thorough washing removes surface residues. Apple juice, similar to orange juice, cannot replicate the benefits of whole apples. The juicing process removes fiber and concentrates fructose, creating a beverage that may actually increase uric acid levels through rapid fructose delivery. The emphasis must remain on whole fruit consumption for gout management. Dried apples require portion control, as the water removal concentrates both nutrients and sugars. While they retain fiber and some polyphenol, the higher caloric and sugar density per volume makes overconsumption easy. Fresh apples are preferable for regular consumption. Cooked apples retain most of their fiber and many polyphenol, though heat-sensitive vitamins like vitamin C decrease. Baked apples or unsweetened applesauce still provide soluble fiber and support gut health. These preparations offer variety while maintaining therapeutic benefits.